Welcome again, friends. In this video we will going to discuss about spectrum of activity. This will going to be another video from the antibiotic video lecture series. So today we will going to discuss about the spectrum of activity. Okay, so let's get started. So the different ranges of microbes against which a antibacterial agent or antibiotics act are called spectrum of activity. Okay, so this spectrum of activity can be divided into two parts. One is narrow spectrum antibiotic, another one is broad spectrum antibiotic. Okay, so let's understand the concept of narrow spectrum antibiotic and broad spectrum antibiotic. So let's consider A is a kind of antibiotic and B is another kind of antibiotic. Okay, A is specifically effective against, let's say, one type of antibiotic only, the one type of bacteria only. Okay, that means A is effective against one type of bacteria and B is effective against, let's say, 6 different type of bacteria. Okay, so as you can see, in the first case the effectivity of A is only towards one kind of antibiotic. That means the spectrum of activity for A is narrow, right? Because here only one microorganism type is present, right? So the number one type of antibiotic, that is A antibiotics, are called narrow spectrum antibiotic. Okay, so this kind of antibiotics are mainly used when you know which microorganism is responsible for the infection in the patient. Okay, so it is often recommended to use this kind of antibiotic only when you are sure about, yes, that microorganism is responsible for that particular type of infection. Okay, because when you know that, let's say, for X infection Y microbes is responsible, so if you going to use a broad spectrum antibiotic, and obviously broad spectrum antibiotic will be the B type of antibiotic, that means it is specific for 6 different or different many other types of antibiotic. So when you are going to use B instead of, let's say, when you going to use B instead of A, there is a chance that B will facilitate the emergence of drug resistance. Okay, that means as it is B was effective against 6 different type of bacteria, so B providing the chance to develop drug resistance to the bacteria, okay, against that particular type of antibiotic. Okay, and as a result, when that particular person or any kind of person develop a infection which is responsible for that X bacteria, you will no longer able to use B. Okay, so that is why when it is often recommended, when you know that particular type of infection is for that particular type of microorganism, it is advised to use that particular type of antibiotic instead of using broad spectrum antibiotic. Okay, so that is the concept of narrow spectrum antibiotic. So let's talk about the example. Okay, so can you tell me or can you guess what type of example should fit in narrow spectrum antibiotic? I have already discussed with you. Yes, exactly, that is the isoniazid. Okay, so isoniazid is nothing but the antibiotic which have the ability to destroy mycolic acid synthesis. Okay, it prevents mycolic acid synthesis. So as a result, cell wall of the Mycobacterium tuberculosis cannot form. Okay, so it is specifically for Mycobacterium. right? So it can be example of narrow spectrum antibiotic, because other cell wall of other bacteria are made up of not lipid, right? They are made up of any other, mainly peptidoglycans, right? So that is the idea. So example of the main example of narrow spectrum antibiotic is isoniazid, and you can also use polymyxin, which is a polypeptide type antibiotic. Okay, so this is the concept of narrow spectrum antibiotic. You will use narrow spectrum antibiotic when you know that yes, that particular type of microorganism is responsible for that particular type of infection. Okay, and under such circumstances it is necessary to use narrow spectrum antibiotic to prevent the chance of emergence of drug resistance. Okay, clear? So now let's move to the next one, that is broad spectrum antibiotic. Okay, broad spectrum antibiotic means the antibacterial agent which have the ability to show its effect on different range of microorganisms, right? So that's what I have written here. Antimicrobial effective against a wide variety of microbial type, right? For example, a drug effective against both gram positive and gram negative bacteria. Clear? So a broad spectrum antibiotic is often used when you don't know which organism is responsible for which type of infection. Okay, but there is a chance of emergence of drug resistance when you will using broad spectrum antibiotic. Okay, and that is why I have explained you that when you know that particular infection is because of particular type of organism, please use narrow spectrum antibiotic. Okay, and when you don't know, okay, that is no problem, but there is a chance of emergence of drug resistance. Mind it very carefully. Okay, so can you guess which kind of antibiotic should be under broad spectrum antibiotic? Yes, obviously, mainly the protein synthesis inhibitors should be under broad spectrum antibiotic, because most of the bacteria have same type of protein synthesis machinery, right? So tetracycline, streptomycin. Clear? So that is the concept of spectrum of activity, that is the different range of microorganisms which are affected by a particular type of antibiotics are called spectrum of activity. So I have told you the narrow spectrum antibiotic, which antibiotics are specific to only one type of microorganism, for example our isoniazid, and we will using narrow spectrum antibiotic when we know which microorganism is responsible for which type of infection. Okay, and narrow spectrum and antibiotic, the most biggest advantage of narrow spectrum antibiotic is it minimizes the chance of drug resistance. Okay, but the opposite will be in case of broad spectrum antibiotic, which is specific for a different range of bacteria, and broad spectrum antibiotic is especially useful when you don't know which microorganism is the responsible organism for that particular infection. Okay, and under such circumstances you have to use such kind of drug, but it will emerge the chance of drug resistance. Okay, so example tetracycline, streptomycin. Clear? So now I will going to provide you a chart for different range of activity. So we have divided antibiotics or bacterial antibiotics, because we are using antibiotics only in case of bacteria, right? So first one is narrow spectrum, second one is moderate spectrum, third one is moderate spectrum, and the last one is broad spectrum. Okay, and there is a additional one, that is antimicrobacterial. Okay, so let's discuss. So first one is narrow spectrum. Narrow spectrum, for example, which microorganisms are only responsible for gram positive bacteria, or let's say only responsible for gram negative bacterial inhibition, will be considered as narrow spectrum antibiotic. It can be used for actinomycin, corynebacterium, bacillus, clostridia, pyogenic cocci, spirochetes infection. Okay, so Example of those antibiotics are macrolides, which is a 50S inhibitor. We know erythromycin is the example of macrolides. Polypeptide, polymyxin is the example of polypeptide. Okay, so narrow spectrum antibiotic we are using for treating a specific kind of microorganism, let's say for gram positive bacteria. Okay, and examples are, we can use macrolide and we can also use polypeptide type antibiotic. Okay, now let's talk about moderate spectrum. So moderate spectrum have the ability to show their effect against gram positive plus systematic along with enteric and urinary tract gram negative. Okay, sulfonamides, aminoglycoside. Let's move back to the next one, that is narrow moderate spectrum. So it is especially useful for gram positive and gram negative bacteria. Okay, mainly beta lactam antibiotics such as penicillin, ampicillin, cephalosporins type antibiotics are useful. Broad spectrum antibiotic, all prokaryotes except mycobacteria and our pseudomonas can be considered as a broad spectrum. For example, chloramphenicol, tetracycline. And the last one is antimycobacterial. Okay, for example, let's say mycobacteria. So example of antibiotics are isoniazid, ethambutol, rifampicin and streptomycin. So that's it for today, friends. So today we have discussed about the spectrum of activity. So I can hope that you have understood the concept very well. Okay, so just recapitulate it once again. So spectrum of activity means the different ranges of microorganism against which a antibiotic can act, right? And this is called spectrum of activity. So depending on this spectrum of activity, antibiotics can be divided into two parts. Narrow spectrum antibiotic, that means in which the spectrum of that particular drug is narrow, right? So if this kind of antimicrobial agent is effective against specifically a particular type of microorganism, okay, and this kind of drug only used when you know about which microorganism is responsible for that particular type of infection, okay, they will minimizes the chance of drug resistance. Okay, for example, polymyxin, isoniazid. The next one is broad spectrum antibiotic. So what do you mean by broad spectrum antibiotic? Broad spectrum antibiotic is nothing but the antimicrobial agents which are responsible for a broad range of bacterial inhibition. Okay, so broad spectrum antibiotics are effective against a wide range of microorganisms. So they are mainly used when we don't know which organism is responsible for that particular type of disease. Okay, and using such drug increases the chance of organism get resistance for that type of drug. Okay, so remember it again that we will use broad spectrum antibiotic only when we cannot make it out that which microorganism is responsible for that particular disease. Okay, we cannot rely on broad spectrum antibiotic too much because it have the ability to create drug resistance. Okay, and here we have discussed about the range of activities. We have divided bacteria into four parts actually: narrow spectrum, moderate narrow spectrum, or narrow moderate spectrum, broad spectrum, and last one is antimicrobacterial. Okay, so that's it for today, friends. So I hope this video will be helpful to you, and thank you for listening to this class.